information has it that just 5% of the population is covered by the National Health Insurance Scheme. That means the rest that aren't covered have to pay out of pocket when they get to the hospitals. Now, with the management crisis rocking the board of the NHIS, it begs the question, how effective is this scheme? You're watching Root Cause on Rootstv Nigeria. My name is Gloria Oji Emodi, and today we are pulling out the scorecard as we assess the effectiveness of the NHIS. So you follow us as we show you all the angles, and then you can score NHIS yourself. Just few days ago, for the first time since his ordeal with corruption allegations, the embattled executive secretary of the National Health Insurance Scheme, Usman Yusuf, railed out the mandate of the policy and how it should work.
The mandate of the NHIS is crystal clear: universal healthcare coverage. What that is a very simple but noble concept, that every Nigerian, all 180 million of us, are entitled to good quality health care, and that it is a human right. It is a way to alleviate poverty in our people.
To find out firsthand how the scheme is faring, we took a trip to the National Hospital, Abuja. You're still watching Root Cause on Rootstv Nigeria, and right now we are talking to Dr. Tayo Hastrop, who is, of course, in charge of information here at the National Hospital. Welcome, Doctor.
Thank you so much.
So our basic question really is the NHIS, its effectiveness as it is right now, and what are some of the challenges that it's facing?
Well, thank you so much. NHIS, for now, with our assessment, is working. Because the program is on and is functioning. For National Hospital, with our own experience, we have a lot of enrollees. You know, more people prefer to come to National Hospital for to register with the NHIS program. People should be having as a record about 12,000 enrollees. For National Hospital, we've been talking loud that we having issues in terms of funding from NHIS. You know, if you look at the gynae aspect of the hospital, pregnant women and others, if you look at what they pay for cesarean operation, is too low to what we charge there. So generally, the fee that have been charged that NHIS is paying back, you know, is not does not match up with what we spend on patients. So this is very important for us to look at. But generally, that does not say that we don't have NHIS in this country. We have NHIS, but it's just our prayer is that it should be more effective. You know, it should go around to both people in the informal sector. You know, more of what we do, the regular ones, at the formal sector.
All right, you're still watching Root Cause right here on Rootstv Nigeria. We're going to go out and talk to some patients who are on the NHIS to have an idea of their experience. Stay with us. While at the hospital, many patients chose not to speak on camera as they complained the scheme doesn't give them desired services. However, Joy Amedu was full of praises for the NHIS scheme.
This is very, very helping me because two of my children, they are SS, and without any NHIS, I cannot cope with them.
So ordinarily, how much would have been the bills, and what is NHIS helping you to cut down?
The bill, like now, the draws where they write for me, let me check. I'm going to pay 90% of it. That is 645 naira.
So that's how good NHIS has been.
Yes.
Thank you very much.
Thank you.
On the contrary, the case was quite different with a second patient.
No, I'm not on NHIS because I'm not aware about it.
Speaking with Obinna Obichukwu, a health insurance broker, he suggested some possible remedies to the health insurance deficiencies. What is the solution? Because a lot of Nigerians need health insurance cover.
The solution is actually looking for a way to get people's confidence back in the scheme. You know, you hear about people saying that the scheme is not all encompassing. You pay, they make these deductions, and then when you get to the hospitals, you are not treated well. So basically what we should be looking at is how to make those that enroll feel important, you know, and we think we should start changing our perception about health insurance scheme. It's the best access to basic health care everywhere. It's been proven. So but why Nigerians are not engaged, you know, there is this thing about our superstitious belief. We always say I'm covered by blood of Jesus and all that, you know, but you still see these people that say all these things, insure their cars, their shops and other businesses they do.
Health insurance is absolutely important in every society because we all need affordable health care. Now, health insurance is always challenged in various societies in the world. Even the, so-called developed countries have their own issues. But beyond the bureaucratic challenges with the NHIS board, there is need for the government to do more to provide us with affordable health care. So what's your score of the NHIS after seeing, all the angles that we have provided? Share your thoughts with us on our social media platforms, or you can comment on the comment section of this video. You've been watching Root Cause on Rootstv Nigeria. My name is Gloria Oji Emode.